Assalamu alaikum doctor, I hope you're doing good. Okay, let's just evaluate this letter. This is okay. Date of this I find Mr. Adam Knowles, date of birth fine. I'm writing this letter to urgently refer Mr. Knowles for assessment of possible pancreatic cancer. Yeah, that is okay, but what are your demands? So what are your demands? It was see, I understand that you're writing assessment, but this is not particular demand. You are asking the person whom you are referring that the person might need endoscopy. So you have to write that your further assessment, including a possibility of endoscopy, would be appreciated. So that should be mentioned. Your purpose is not wrong. It's incomplete. This is what I told you last time as well. And after dear Dr. Desai, there should be comma as well. And in between this and this, there should also be a comma. Mr. Mills is a 68 years old, married, retired management consultant, leads an active lifestyle, doesn't smoke and drinks occasionally. Past medical history is significant for severe eczema and depression only. His past medical history. Okay. On this date, Mr. Knowles presented with complaint of heartburn and indigestion not sufficiently managed by over-the-counter antacids. Physical examination was non-significant. Omeprazole 20 mg twice a day was prescribed, and a follow-up after 4 weeks with repeats is not a good word. FBC and LFTs were advised, because you're talking about two things. First of all, when you said a follow-up after 4 weeks was requested, that's it. Then there is no need to write this thing. Eventually, when you'll write the next paragraph and you'll mention the investigation results, they will eventually understand that what is right and what is wrong and how you have done it. Okay, so that's the thing. Okay, today he reports new onset back pain, a loose and what is this? Colored stools, pain after eating meals, fatigue with no improvement in previous symptoms. Whenever you're starting a new paragraph, write today Mr. Knowles, and it's not reports, has reported. Okay, new onset of back pain, or you can write new onset back pain as well, but I would prefer writing off as well. Loose stools, pain after. His examination reveals tender and distended abdomen, yellowy to eyes and skin, with 2 kilograms weight loss since last visit. His serum chemistry, am I right? See, the problem is that you can join the word this way, but when you join it should make sense. Now if I am a reader and I am having difficulty even in reading this word severe, it is not making sense. Your score will drastically decline if you write this word. So I would suggest writing clear words this way. Now this somehow is making sense that it is severe. This is not making sense that is severe. What is chemistry? Okay, just see and the other thing is, this is not IELTS where you have to write very different and grammatical very good words and sentences, and you have to create new words from different sort of vocabulary and that you have to add. No, it's a simple OET exam. Case notes are given. Use the language which is given inside the case note and copy paste that information with proper orientation of the writing style on your paper, and you will eventually pass with 350 plus. This is the requirement. You don't need to be native speaker for this. Okay, try not to be one actually. Okay, and try to write information clearly. Now this is the poor way of writing anything. Showed significant rise in bilirubin, amylase, and albumin. Mr. Noels has now see even it is not making any sense to me. What is this? It is making sense to you, but for me it's not possible. Seen regarding his examination finding lab, never write lab reports, they should be laboratory reports, the full form, and a suspicion of likely pancreatic cancer. Now you were asking me about your conclusion. See, as I mentioned, do not think that the purpose and the conclusion are somehow the meaning is same, so it will be a problem of don't think that way. You need 350, and if you write the way I'm telling you, you'll get 350. But the problem is that if you write this way, now this is not a good I would say a paragraph to end your letter. So just write, in view of the above, I would be grateful if you could further assess and provide the care Mrs. Noels requires, okay, or some other way. Okay, just follow this template. In view of the above, I would be grateful if you could further assess and manage Mr. Noels appropriately. That's it. There's no need to write anything else, this lab, that lab, which lab, doesn't make any sense. Okay, just write this way. You will eventually go through it. You are kindly requested to further evaluate his symptom and perform an endoscopy. Now okay, this is somehow okay. If you're now, this information is that you have discussed the whole thing with Mr. Noel, right? So why are you writing this paragraph separately? You should write this in here because it's the part of today's visit. So you can just write, please note a discussion regarding possibility of pancreatic cancer have been made with Mr. Noels. That's it. Nothing else. Simple, clear, compound. Other things are good. So I won't say that your writing style is bad or you don't write good letter. The problem is that you are trying to write perfect letter, and that's why you're getting problems and you're making more mistakes. Try not to write perfect letter. We are humans, we can make mistakes, and we are not native speakers, so that's why out of 500 you need 350, so you have a 150 marks gap. Why won't you use that? Just use it and use it carefully, okay, and inshallah you're gonna pass through it, okay.